This is the profile of the erstwhile Visakhapatnam district, sir. We had a population of around 42 lakhs, and we had around 4 lakhs 50,000 0 to 6 year child population. So in fact, we are the one district with the highest agency area. If you look at the district area, it is around 52% for the district. Now, sir, recently the district got divided into 3 small districts. Now I am holding the district of Visakhapatnam, which is majorly urban. The profile of the bifurcated Visakhapatnam district is like this, sir. Now we are having around 20 lakhs population, and of course it is urban mostly in terms of population, sir. That is around 90% of population is urbanized, and by 60% in the terms of area also. This is the overview of the Niti Aayog indicators for any aspirational district, sir. Majorly it is focused on the 5 themes and sectors and 49 indicators and 87 data points. This, of course, the periodicity of indicators was mentioned here. Some of the indicators are monthly, and some of the indicators are quarterly, and of course some of the indicators are half yearly and yearly. In fact, for the month of March, sir, we have secured 63rd Delta rank. So in fact, there is a lot to improve for the district of Visakhapatnam. Especially for impacting the positive change in the children, it's a multifold effort, and majorly these 3 departments, women and child development, education and medical health, have been continuously putting their efforts to bring the change in the children, sir. If we look at the some of the initiatives by the women and child development department, sir, especially at the grassroots level, that is at the level of the Anganwadi worker, they are very well connected with the mothers, especially both the pregnant women and also the lactating women, and they have formed WhatsApp groups also with the mothers and the lactating, pregnant women and lactating mothers. That way they are very much intricately linked to the kin and kith of the mothers, and of course with the children. That way a better climate is enabled, so that there will be constant understanding between the department and also the clients in this case. Similarly, sir, we are also continuously promoting the community-based events like Annaprasana. Here also, especially to bring the early intervention changes and to bring better enabling climate among the mothers, children, and also the staff. So this has really improved the acceptability and enrollment in the district of Visakhapatnam, sir. So if we look at the impact also from the year 2018 to 2022, in fact the registrations have improved from 1,48,000 to 1,74,000, and similarly if we also look at the children, especially who are taking the supplementary diet, the number increased from 1,22,000 to 1,44,000, sir, in the last 3.5 years. Then similarly, sir, for the Anganwadi children, it's again a threefold effort kept by the government of Andhra Pradesh. They try to improve the premises, then focus on the food, and of course on the education system also. So looking at the premises development, sir, in the year 2018, we had around 1547 government buildings in this district of Visakhapatnam. Now it has gone to 1795. Similarly, most of the existing Anganwadi buildings, they were also upgraded, and they were given the corporate look with the help of government and local CSR funds, and of course some of the funds available with the district administration, sir. with which again the not only corporate look came for the Anganwadi buildings. So students and the parents started owning up the school also, and there was a huge applause and enrollment from the villages on this. Then, sir, the next initiative especially was based on the national education policy. These PP1, PP2 books and workbooks have been redesigned by the government of Andhra Pradesh with a major focus on the skills of English learning and arithmetical and social skills. And almost all the CDPOs, supervisors and Anganwadi workers were also properly trained to suit to the requirements of the revised syllabus and workbooks so that they can teach the students very well on this, sir. Then similarly, sir, spot feeding is just one initiative which has again brought the applause from all the stakeholders. Apart from the sambar rice, there are other diversified menu also which is added to the spot feeding program, sir. It again has increased the enrollment numbers in the Anganwadi centers. So if we look at the numbers, from 81,000 it has risen to 88,000 in the district of Visakhapatnam, sir, in the last 3.5 years. Then looking at the supplementary implementation, thanks to Poshan Abhiyan. In addition to that, sir, the government of Andhra Pradesh has also taken the initiative to implement both YSR Sampurna Poshana Plus and also YSR Sampurna Poshana, wherein, sir, apart from what the government of India on the 50-50 base, ratio basis is being given, government has already added 4 more items, especially milk, eggs, vegetables, and also balamrutam for both the pregnant and lactating women and 3 to 6 year children, and also 6 months to 3 year children, this, sir. Apart from this, and especially with a major focus on the pregnant women and lactating mothers to reduce the anemia and other kind of disorders which they commonly encounter during the pregnancy, sir. Okay, one more take-home ration kit was also designed and it is being implemented, sir, which is really very exclusive to the state of Andhra Pradesh. And there again, 5 items have been given to the tribal women, sir, especially under the YSR Sampurna Poshana Plus scheme, and of course under the YSR Sampurna Poshana scheme, 6 items were being delivered to the pregnant and lactating mothers every month, sir. Sir, with all these interventions, some of the indicators have shown a drastic development and improvement in the district of Visakhapatnam, sir. If we really look at some of the indicators here, so the pregnant women taking the supplementary nutrition has gone from 92% to 99%, sir. And the lactating mothers who are regularly taking the supplementary nutrition has gone from 92 to 99%. Then the children between the 7 to 36 months, sir, who are regularly taking the supplementary nutrition has gone from 83% to 98%. And similarly, the percentage of children, especially with the 3 to 6 years age group, who are taking the supplementary nutrition has gone from 83 to 90%, sir. It is one of the impact on the indicators as mandated by the Niti Aayog under the aspirational district program, sir. Then, sir, on the education front, this is a district initiative, sir, thanks to Niti Aayog. Niti Aayog has sanctioned rupees 2.9 crores for the district, sir. It was sanctioned in the year 2019, and very recently, sir, by the March of this year, we have implemented the program of smart classes, sir. That again, in the Paderu and Araku area, we have implemented this scheme, sir, where it is the most needed place. So it was done in 650 classes. Sir, some 5 basic elements have been given to these 650 schools, sir. This is at least one smart TV, then 64 GB pen drive, electrification, and service connections were given. And also the teaching and learning materials were also provided, sir. And audio visual, and of course the digital content has also being provided to all these 650 schools. So in fact, so the actual impact has to be studied, sir, because the implementation has completed just 2 months back, sir. Now again, the district got reorganized into 3 districts. Now this entire work is falling in the district of Alluri Sitaramaraj district, sir, which is now headed by the one more collector, Mr. Sumit, who is sitting in the first bench, sir. Then, so this is one more district-specific program, sir, which is done by the district of Visakhapatnam, sir. This is called LEAD, sir, Learning Enhancement and Development Program, which we have done, sir. This was done from the 17th November of last year to 30th of this April, sir. This is majorly to focus on the improvement of learning skills for the children, especially post-COVID, sir. Sir, we have done one initial basic survey, baseline survey was done for all the students studying in the government schools, and we have almost identified more than 60 to 70,000 children, sir, who are lagging behind in terms of the basic language abilities and also the fundamentals in the mathematics. And once the survey is done, we have grouped them into 3 groups, sir. This is like level 1, level 2 and level 3. So in the level 1, class 1 and 2 were included. In the level 2, class 3 to 5 were included. In the level 3, class 6 to 9 were included, sir. We didn't touch 10th class people because they are going to appear for the public exams. So 2 interventions were done. One, we have prepared some very fundamental material with some basics and formulas, some techniques relating to the languages and also mathematics. And this material was distributed to all the schools, to the students, sir. And similarly, every day, a 3-hour session was organized for these children, sir. These people, as soon as they enter the classes, they will not go to their classes. They will sit in these level 1, level 2 and level 3 classes. So wherein for first 3 hours, these 70,000 students, they were taught on the basic skills of languages and fundamentals of mathematics, sir. Now we can also just look at the impact created by this LEAD program, sir. Sir, especially if we look at maths also, initially the gradation was A, B, C, D. So if you look at the A grade for the maths, sir, around 53,000 students were there in that A grade. After the 4.5 months intervention, the number has increased to 66,000. So that means people from the B, C, D levels, the categories, have gone up to the A category, sir, by the intervention of teachers, material, and of course the constant motivation and persuasion from the education department, sir. So likewise, we could improve the understanding and the basic abilities for the most of the students, especially in these languages and mathematics, sir. This is again the graphical representation for the improvement under the languages and also mathematics. Then similarly, sir, there are several government initiatives, thanks to government and our Honorable CM, Sri Y.S. Jagannamohan Reddy Garu, sir. Especially, sir, the Jagananna Ammavadi is a very path-breaking and unique scheme, sir, wherein 50,000 rupees is given to each mother for simply sending their children to the schools promptly, sir. So, in fact, in my district, around 6,24,000 children has got benefited by this scheme, sir. Around 61 crores has been deposited into the accounts of all the mothers, sir. Then the impact we can also see, sir. Every year after the introduction of this scheme, Jagananna Ammavadi, there is a steep increase, sir, from 64,000 almost 69,000 students. I mean, there is increment of 69,000. Sorry, sir. There is from 6,46,000 to 6,91,000 is the latest number who have enrolled into the government schools after the introduction of this Jagananna Ambavadi, sir. Similarly, sir, one more path-breaking and very unique initiative by the government of Andhra Pradesh is Jagananna Gaurumudra, sir. So, in fact, thanks to the Prime Minister's Poshana, sir, apart from the Prime Minister's Poshana, which is a midday meal scheme, which is widely known across the country, sir, the nutrition basket was diversified and enhanced, sir. Now, apart from the sambar, rice, the basic food materials, sir, chikki, akakura, papu, biryani, sweet and hot pongal, eggs. Now, they are a day-to-day affair in all the schools, sir. And in fact, it's widely applauded by the various states also for this scheme, sir. Then, sir, Jagananna Vidya Kanaka, this once again, a very people-friendly and pro-poor initiative by the Honorable CM and the Government of Andhra Pradesh, sir, wherein, sir, 8 basic requirements for all children, right from the uniforms, school bag, the notebooks, shoes, socks, dictionaries and textbooks, all of them as a kit were delivered to all the children who are studying in the government schools, sir. So, in fact, it has really reduced the financial burden on the parents drastically, and at the same time, it has increased the enrollment and a competitive climate for the government schools. Then, sir, again the Manabadi Nadu Nedu. So, in fact, this is also one very important initiative by the government of Andhra Pradesh, wherein they wanted to renovate and give a corporate look to most of the schools, sir. Now, this is a phase-wise phenomena, and phase 1 was completed, wherein 1,031 schools in district of Visakhapatnam were renovated, and almost 9 important facilities were renovated, sir, under that scheme. But in the Nadu Nedu phase 2, one more facility, there is additional classroom was also included, and now there are 10 important infrastructure facilities which are being dealt under the Nadu Nedu phase 2, and now 890 schools with an estimated value of 280 crores was taken up, sir. Now it is in the cards as of now. It is again leading to a big success story, sir. Especially one more state like Delhi has also done this feat. Sir, one major impact which I need to highlight for the Nadu Nedu, sir, especially for the comforts grown for the girl child, sir. So previously, even most of the schools were lacking the toilets for the girl children, sir, either insufficient or sometimes even lacking, sir. But after the introduction of this Nadu Nedu Manabadi scheme, sir, now most of the schools have very decently maintained, separate, very hygienic girl child toilets, sir. It is in fact a matter of dignity for all the girl children of the state, sir. These are some of the evidences under the Nadu Nedu Manabadi.
Can you quickly finish, I think?
Yes, sir, last 2-3 minutes. Then medical health, sir. So we have introduced Tika Express, sir. Especially we have very hostile and tough area in the name of Paderu and Araku. So wherein it is very difficult for the medical and health department to infiltrate to the very household level, sir. We have started Tika Express with the help of the Care India NGO, wherein they have provided almost 14 vehicles in the tribal area, and through which we could complete the vaccination program at a fast pace, sir. Sir, I will directly jump to the birth waiting home, sir. This is again the exclusive program for some of the districts, sir, be it Vizianagaram or Srikakulam or Visakhapatnam, sir. We have introduced the concept of birth waiting homes or birth waiting hostels, sir, wherein in 15 days before the expected date of delivery, these pregnant women along with their kin and kith were brought to these birth waiting hospitals or hostels. So there, under the guidance and monitoring of the medical staff, institutional deliveries were promoted in the tribal areas, sir. Then NRC, sir, Nutrition Rehabilitation Center. Of course, we have two NRC centers, one in KGH and the second in Paderi area, sir. So in fact, we have, after doing the survey for the Sam and Ma'am children, these Sam and Ma'am children, along with their mothers, and of course, with their kin and kith, were brought to these NRCs, were given proper counseling, and they would be discharged once they recover, and they are able to sustain themselves in terms of nutrition strength. Thalassemia, sir, this is one specific problem to the area of Paderu and Arco, sir. Sir, we have done a small assessment, and wherein we have done two-level screening, sir. A primary screening was done for 40,000 students in the schools in the area of Paderu and Araku area, sir, wherein 578 children, and of course some of the even elder children were also identified, and these 578 children were brought to KGH, and subsequently a secondary level screening was also conducted to confirm the thalassemia disorder among these people, sir. Once they were confirmed, sir, a two-level strategy was also implemented. Government of Andhra Pradesh has been giving rupees 10,000 as a monthly support for these thalassemia affected children and also to the elders, sir. And simultaneously, sir, one hostel was also implemented here, wherein some of the very needy thalassemia patients will be given stay for some days here, and they can get the blood transfusion in the local KGH area, and again they can go back to their original habitation, and of course the hostels also, sir. So that way, these interventions, we could able to do some positive impact on the children in the district of Visakhapatnam, sir. Thank you, sir.
Thank you, Dr. Mallikarjun. I hope these will be reflected in the outcomes in the coming days when we evaluate these schemes. Thank you.